Respiratory system pathology. Bronchiactasis, an abnormal and irreversible dilatation of bronchi and bronchioles greater than 2 mm in diameter, proximal to the terminal bronchioles, which may be localized or generalized. It is the result of chronic, necrotizing infection of bronchi and bronchioli, destruction of smooth muscle, and the supporting elastic tissue. The most characteristic clinical manifestation of bronchiectasis is persistent cough with expectoration of copious amount of foul-smelling sputum. Not a primary disorder and always occurs secondary to persistent infection or obstruction. The origin of the inflammatory destructive process of bronchial wall is nearly always the result of three basic mechanisms. 1. Endobronchial obstruction. 2. Necrotizing infections. 3. Hereditary and congenital factors. Macroscopic features. The lungs may be involved diffusely or segmentally. Bilateral involvement of lower lobes occurs more frequently. More vertical air passages of the left lower lobes are more often involved than the right. The airways may be dilated, too, as much as 4 times their usual diameter. Thickened fibrotic pleura. Cut surface shows a honeycombed appearance. The bronchi are extensively dilated nearly to the pleura, with thickened walls and filled with mucopus. Intervening lung parenchyma is reduced. Types 1. Cylindrical, most common. 2. Saccular, rounded. Sac-like. 3. Fusiform, spindle-shaped. 4. Varicose, irregular enlargement. Microscopic features. Bronchial epithelium may be normal, ulcerated, or may show squamous metaplasia. Bronchial wall shows acute and chronic inflammatory cell infiltrate. Replacement of muscle by fibrosis. Fibrosis of the intervening lung parenchyma with intestinal pneumonia of the surrounding lung. The pleura in the affected part is adherent and shows bands of fibrous tissue between pleura and BRO and CHI. In some instances, the necrosis destroys the bronchial or bronchiolar walls, producing an abscess cavity. Clinical features. Severe persistent cough, expectoration of mucopurulent, sometimes fetid, sputum dyspnea, rhinosinusitis, hemoptysis. Complications: Schwantrasti pneumonia, metastatic abscessa myelodoscore pulmonale.